This is the next Biology Unit 6 revision video, which we'll be looking at the development of disease. Disease is a state in which the body is not healthy. Now, this can be caused by various different things. It can be caused by microbes that are pathogenic, which means that they cause infections. It can be caused by diseases such as cancer, which are not infectious. Now, I've mentioned the word infectious, and this is only applicable if the pathogen spreads really quickly from one person to another. So, for example, if you've got an infection such as chickenpox, that spreads extremely easily. This would be infectious. This is a picture of a bacterium called Vibrio cholerae. Now, this is the bacteria that causes the disease cholera. This is a particularly unpleasant disease as it causes the patient to have very severe watery diarrhoea and vomiting. Now, this leads to dehydration very quickly, especially in children. This disease can be treated by intravenous drugs, namely antibiotics, and that will reduce the number of bacteria, hopefully kill them all, and prevent the infection. Then the person will need rehydration, so they will be given water and electrolytes to prevent dehydration from becoming fatal. Now, food poisoning can be transferred by contaminated food. This is usually a bacterial disease, and the symptoms will include things such as stomach pains, diarrhoea, vomiting. It can be extremely severe and can be fatal in the elderly and in children. Influenza is an example of a viral infection, so it's caused by a virus. Now, the family of viruses that it causes influenza are the Orthomyxoviridae family. This virus can be acquired usually by breathing in particles of the virus. It's one of the most common diseases and has symptoms such as sneezing, coughing, headaches and a runny nose. It's not usually a fatal infection, but it can be in elderly people and in people who have got weakened immune systems, for example. Being a viral infection, this will not be cured by antibiotics, so usually the symptoms are treated, such as taking ibuprofen and paracetamol to get rid of pain and headaches, and resting and keeping hydrated. Chickenpox is another example of a viral disease caused by a virus. It is spread by direct contact or by breathing in viruses that have been coughed from the infected person. The symptoms are really quite noticeable. You get a rash on the skin that becomes quite itchy, and the patient will tend to want to scratch it. That can cause scarring. This is usually not a very severe disease, but sometimes patients can suffer headache and fevers. However, this is not usually fatal. It is in some instances where the virus will travel to the brain and cause infection, but usually it's self-limiting. This doesn't usually need treatment, just treatment of the symptoms, for example, giving infant paracetamol if they have headaches and fevers. So this is the fungal infection that I'll talk about. It's athlete's foot. It infects mainly the skin between the toes because it's quite damp and warm there. The symptoms will include cracked, flaky skin. It'll be quite sore, and it may bleed in severe cases. This can be treated by using foot creams or foot powders with antifungal ingredients in there. And here we have a picture of athlete's foot infection, and we can see we've got the dry flaky skin here. This looks quite inflamed, but there's no bleeding at this point. So next we're going to look at how an infectious disease develops within the body. So first of all, we can see that a microbe will enter the body, usually through an opening within the body, such as a mouth, nose, or cuts or bites or injections into the skin. Once it gets inside the body and past the barriers that the body has to prevent pathogens from entering, the microbe begins to use the body to supply its conditions for survival. Now, the body will provide things such as warmth, nutrients and moisture. When they have these optimum conditions, they will begin to reproduce. Now, we've discussed before that reproduction in bacteria or fungi can happen very, very quickly. They produce very large numbers. Bacteria will divide by binary fission, which we get exponential growth from. Now, this time when the numbers are increasing rapidly, we call this the incubation period. So at this point, you wouldn't actually feel ill. Now, as they carry on growing and reproducing, some bacteria and fungi and viruses will produce waste products, which are often toxic, which we'll call toxins. Now, these can be poisonous to the body and can cause symptoms which are very unpleasant. However, most of the time, the symptoms that you actually get from an infection are caused by your immune system trying to fight off the infection itself. So, as I mentioned previously, these toxins will make the body begin to feel unwell. Different types of pathogens will produce different toxins, so you get different symptoms. Now, when you go to the doctor with an infection, the doctor will ask for the symptoms and use what you say as a diagnosis of the disease. Now, this is not always accurate because many infections will have similar symptoms. So some of the symptoms that you might feel when you are being infected by a pathogen are fevers, rashes, sores, headaches and diarrhea. But as you can see, just from those few symptoms, you'll probably associate them with quite a few different infections.